And I've got a bipolar pedal.
Yes, that would be.
Hi guys, this is Charles. I'm one of the surgeons at the Animal Emergency Center in Melbourne. And today we have a little terrier dog that had acute onset of hind limb paralysis. It yelped acutely and suddenly went down in the back end. We've done a CT scan and a myelogram, confirmed the presence of a disc rupture at L1-2 on the left-hand side. And so we are doing a Hemi laminectomy. Now I've put a needle in the spinous process of L4 before the CT scan so that I can tell where my disc space is. Because particularly in the lumbar vertebrae, there aren't a lot of landmarks to tell you where you are, except for the last rib. And you can kind of also tell from the location of the cranial end of the iliac wing. That's even with L6-7. So by using a needle, which I have right here, I have to extend my incision a little bit further to be able to pull the needle out. So that's my needle right there. So let's count forward. We have L4, L3, L2, L1. So just to confirm, L4, 3, 2, 1. So I'll just mark these. In fact, I'm not going to pull that out yet, just a little crowdsourcing. If you guys don't see me pull that needle out, you have to remind me before I close. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. All right, so that's L1, 2, 3, 4, confirming. And then that's the last rib up there. All right, so I'm just dissecting around the spinous processes. All right, then I'll take my Fourier elevator and peel that epaxial muscle off the spinous process. And this is a pretty big dog. It's an 11-kilo dog compared to the 4-kilo dachshunds that we are normally doing. So I'll be operating in a little bit of a hole. I hope you guys will be able to see. So I can feel the articular facet right in there. So I might go ahead and start getting some Gelpies in. That's very funny that somebody just made the comment 6'7".
What does that mean?
It's just I think it's from a cartoon or something, and then for some reason kids in primary school commonly say 6'7" to their teachers and find themselves very amusing, but it doesn't have any real meaning.
Wow, okay.
And so for somebody to say it on the live stream is actually quite funny. So I'm using bipolar now to dissect away the muscle. from the articular facet. I'll get my Gelpy in deeper. So we'll get another Gelpy in here. All right, how's that view? Not too bad. Okay. And we had a few people commenting previously, wondering where we were. And just Australia, I don't know if it's like other countries, but Australia gets kind of crazy around the holidays. And things just get weird and people go away and whatever. And so that's why I wasn't live streaming. Now I'm back and I'm going away again tomorrow for a little while for a conference. Then I'll be back mid-February.
Is that a conference in India or
No,
just
Thailand.
Thailand?
And it's my wife's conference, so I'm just going as support staff for my wife, carry her luggage. And I'm sorry I can't zoom in anymore. That's the max that my camera can zoom. Still think you've got a reasonably good view. I might move it over a little bit. Not that way, that way. And down a little bit. Okay, let's get a little flush. Thank you. Now I'm going to go ahead and use my bipolar to expose a little bit farther ventral, because I'm going to have to do a fenestration, and I might as well increase my exposure now. All right, so then we'll get in with a large rongeur and take away our articular facet. It's right here. That's all good, I won't need that. Okay, how's that look? Good. All right, so now we'll just get our flush in just about a drop a second. Can you try to come from the top? Okay, big flush. Another flush, please. Thank you. Kind of get an idea of the shape of the laminectomy now. And so hemorrhage, if we have any, we deal with either collagen foam or electrocautery, bipolar. Okay, big flush. And I won't be able to answer any unrelated questions in the middle of a neurosurgery. I apologize. Another flush, please. Okay. Big flush, please. So this is a very deep hole, and it's a thick bone. So I'm looking down onto the endosteal surface right there. So we're getting close to getting into the spinal canal. Flush, please. Thank you. So I can already see some bruising in there. A bit more flush, please. Yep, thank you. So that tells me that I'm at the right spot. I'm just going to do a little more bipolar in order to increase my exposure cranially. Because I'm going to have to extend my laminectomy a little bit farther cranial.
Did you just say you already see some bruising?
Yeah. So the bruising's right in there.
And just because it's already kind of dark.
Yeah, so it's kind of purpley. Yeah. I beg your pardon?
Can she have another 0.1 methadone? She only have 0.17.
Yeah. Is she waking up a little bit?
She's just like,
Yeah. Go ahead and give her some more meth. There's a question between the difference between bipolar and monopolar electrocautery. With bipolar, the electrical current goes just between the two ends here. With monopolar, it goes between the end of the pencil and the ground plate, which is underneath the dog. So the electrical impulse actually travels through the dog with monopolar, but it's generally a bit more effective. Whereas bipolar, if you're going close to the spinal cord and things like that, you're less likely to get, electric shock to the spinal cord. Okay, so a bit more flush. Let's go ahead and get our pick. So this is a dental scaler. It's called a Morse scaler. Really nice and sharp. And I can use it to pick away the soft tissue. And also once I get to disc material, I can use it to scoop the disc material out of the spinal canal. Okay, there's a bit of disc material right there. I'll get a small rongeur. Let's get a smaller suction tip, please. So this is a bit tricky. I'm going into the spinal canal with one blade of the rongeur, which you run the risk of compressing the spinal cord. And the spinal cord is extremely delicate. Bit of hemorrhage there, probably from the sinus. Can you get some flush, please? Yeah. Thank you, that's great. Okay, so that's nerve root right there. And that's more disc material that's coming out right there. And the L1-2 nerve root's not particularly important, so if you had to sacrifice that to get better exposure, it's called doing a rhizotomy. And there's no negative effect from that except maybe losing a little bit of sensation to the skin. So there's a bunch of disc material coming out there. There's a nice big chunk of disc material coming out there. Just grab that with a rongeur. So that was all compressing the spinal cord there. I don't know if you guys can see that. So I'm back into epidural fat back here, which tells me that I've gotten to the caudal extent of the compression. So I'm into the disc space itself. And try to come in caudal to the disc and scoop it out. So I'm actually right underneath the spinal cord here. It's always a little bit nerve-wracking. So lots more disc material out there. There's a big, big wad of disc material. It's kind of adhered. There it is. Can I get a 3 mil blade, please? 3 mil burr. Okay, so now I'm going to use, all right, so I need you to really carefully suction right here, and you're right next to the spinal cord, okay?
Yep.
Okay, so you need to cover that hole. Yep. And pull out just a little bit so you get a little bit better suction. So I'm suctioning into the disc, drilling into the disc space.
You need some flush?
Yes, please. Yeah, great, thanks. So drilling into that disc space so that I can scoop out
The rest of
the rest of the disc, yeah. Can we get some bupivacaine, please?
maybe 5 minutes later is fine.
So I'm just trying to prevent more disc material from coming out later on that would cause recurrence of clinical signs. Okay. All right, so that's pretty much it for this surgery. A little bit of disc material still in the spinal canal. Okay, can I get a little bit of collagen foam, please? As in Liostip. And I always fenestrate the one space. And if the bleeding doesn't stop, I mean, it always stops eventually. It depends on whether it's serious, like hemorrhage, or, yeah, that's great. Serious hemorrhage, or if it's just oozing. If it's just oozing, sometimes I'll put in a little drain just to prevent pressure on the spinal cord from a hematoma. So I've just put in a little collagen foam in there, and my burr is at 60,000 revolutions per minute. We'll just leave that for a few minutes.
It's 11 kilograms.
So I'm just injecting some Is this bupivacaine?
Yes.
I find that using bupivacaine after these surgeries really decreases the amount of pain that you get post-operatively. I'll take some 2O PDS, please. Oh, we need to pull our needle out. Did we already do that? No. Okay, so that's our little piece of needle right there. Need a half that, please. And do I have a Adson thumb forceps? Yeah. Half that lengthwise. Can I get a butterfly do we have butterfly catheters? Regarding the VetDojo courses, I will be reopening them for registration, just not just yet. Either one. I'll be cutting the needle off. All right, so what I'm going to do here is I've got a vacutainer, sorry, a butterfly. I'm going to cut the needle off. And then add a few more little fenestrations. Okay, and then let's get a blade, and we'll cut down onto that and just make the smallest hole you possibly can. Just right over. Yep. And then I'll pull that through. I'm just going to lay it down in the, can I get some, maybe some, no, just leave that like that, I think. Just see what happens if we suction on that, whether yeah. All right, so that is going to drain. Any hematoma, and we'll drain that every probably half an hour for the next couple of hours, just until we're confident that the bleeding has stopped. Because what I don't want to happen is for it to form a hematoma that compresses the spinal cord. And I will pull this out in the next few hours. Okay, got it from here? Thank you very much. Just go back, and the tube is just for draining blood, so it doesn't form a hematoma. That is all. And I will remove it in the next couple of hours. Just taking my loops off, putting my glasses on so I can see if there are any questions that I haven't answered. So regarding deciding where we operate, I do a CAT scan and a myelogram here. That's what I've always done because I've never had an MRI in-house. If I had an MRI in-house, we would do an MRI instead. So yeah, CT myelogram. So usually, well, the difference between an extrusion and a protrusion is not really clear. I mean, basically what we're saying is anytime you have disc material that's outside the normal confines of the disc space is abnormal, and that's something that we need to address. I think you may be talking about whether it's a type 1 or type 2 Hansen's disc rupture. So type 1 is when you have nucleus pulposus, which explodes through the annulus and compresses the spinal cord, compared to a type 2, which is usually more chronic, often bigger dogs, where we have annulus fibrosis, which is bulging into the spinal canal. And they're treated, I mean, basically the same in that you have to get in there and you have to remove the offending material that's compressing the spinal cord. So regarding visualization for cholecystectomy, we use just Balfours. Occasionally, if you really need to get up there cranially, you can make a little fenestration in the diaphragm, create a diaphragmatic hernia as long as you have them on a ventilator. And then when you get air behind the diaphragm that really allows the liver to fall backward and really increases your visualization. But we only need that in very select cases. All right, well, I'll just go to the bottom, make sure there aren't any other questions. There's a question. Did you try to apply prednisolone after the surgery at the surgical site? No, so that doesn't help. There's no evidence that that improves outcomes with these guys, and they have looked at all those different types of things. And so no, that's not something that we do, putting prednisolone at the surgery site. All right, well, if that's it, I'll go ahead and wrap up the live stream. Thank you very much for watching. If you haven't already done so, please subscribe to our channel. And also, if you know of anybody else that'd be interested in this, either vet students, pet owners, or anybody, please send them a link to the channel and get them to subscribe. Anyway, thanks a lot, and I will talk to you soon. Also, it's Jack66. Congratulations on getting into vet school in the UK. Hopefully, we'll see a lot more of you in the coming years. Anyway, we will talk to you again soon.